Medicare open enrollment begins October 15th, and it can be a confusing time for retirees. Joining us now is local financial expert Brad Zucker from Safe Money Advisors to go over 4 common misconceptions about Medicare. Now, Brad, there are a lot of misconceptions out there. So first, many people think Medicare is free. So is it really free?
Okay, that's a big misconception. In fact, a recent study showed half of Americans think Medicare is free. But in reality, retirees are going to wind up paying for their Medicare through premiums and deductibles and copays. So if you're turning 65 or you're over 65, you've got a lot of options. Medicare Part A, that's hospital insurance. There's no premiums. Part B, that's outpatient services. You pay a premium. Part D, prescription medications, you pay a premium. So depending on the plan that you choose, Nina, you may wind up paying about 20% of your own medical costs.
Now, people would ask, what does it cover?
Okay, so there are a lot of services that are provided by Medicare. However, older Americans are going to find themselves paying for their own dental care, eye exams, hearing aids. If you want those expenses covered, you need what's called a Medicare Advantage plan, and some Medicare Advantage plans will cover those expenses. But Medicare does not pay for the expenses involving long-term care, like assisted living and nursing homes. This is why people buy long-term care insurance. A typical policy will pay the benefits for adult daycare, Alzheimer treatment centers, assisted living, nursing homes, and hospice.
Now, we were talking about open enrollment starting on October 15th, but for people who are actually turning 65, what are their options if it doesn't fall between that October 15th period?
Perfect. So if you're turning 65 this year, you can start enrollment during your birth month or 3 months before or as long as 3 months after. If you miss that 6-month window of opportunity, you could be stuck with excessive premiums for the rest of your life. If you're over 65 and you're already a Medicare recipient, the open enrollment period starts from October 15th to December 7th, where you've got the opportunity to adjust your plans to meet your needs and your budget. And if you really want to get a good estimate as to what this stuff is going to cost you, go to our website at Safe Money Advisors. You'll find a Medicare calculator to help you get started.
Yeah. Now, just wrapping up, what should people know when in terms of what should be their right plan that they're looking for?
Well, if you're confused about it, and Medicare, I should say, is anything but easy to understand. If you're already on Medicare, use the open enrollment period starting October 15th to meet your budget each and every year. If you're about to retire from a company and you're transitioning from employer health plan to Medicare, start the ball rolling 2 to 3 months before. And if you're quite still confused about this, sit down with a professional that can help steer you in the right direction.
Yeah, that is always important. Of course, professional advice. That's why we always appreciate having you here. Thank you so much for joining us, Brad.
Absolutely, my pleasure.
Yes, and of course, Brad will join us every first Saturday of the month because money talks, and he will help you with your financial problems. And still to come, a chance